The issue of size and shape of the penis is a big deal for a lot of people. Statistically, 90% of men nationally are just unhappy with the size of the penis, and a lot of it has to do with comparing themselves with a guideline or a gold standard that may not be accurate. There are a lot of things that are done in an attempt to improve the size of the penis, which is absolutely dangerous and counterproductive, and the end result usually is a surgical procedure that leaves a penis that is deformed and actually scarred and shorter than what that individual started out with. And so there are certain things that need to be looked at. The penis in the flaccid state is very different for most people when you compare that to the penis in the tumescent or full or engorged state. That's the first issue. The second issue is that there are deformities, curvatures, scars that sometimes can occur through traumas or development of something called Peyronie's plaque, or changes in the expansile tissue of the penis that can be corrected. There are ways of preserving the size and shape of the tissue that you have. Remember, this is live tissue, and live tissue requires oxygen. And if one of those main 4 categories of problems that result in sexual dysfunction, blood flow or vascular problems, if your blood flow is down, then that means that you're not getting enough oxygen to that tissue. And so over time, people will identify a foreshortening or an actual narrowing of the shaft of the penis. So there are some clear preventative type things that can be done to preserve the tissue, stop the shrinkage, if you will, that will allow people to feel more comfortable in the morphology or the cosmetics of the penis itself. That has to do with good healthy diet and exercise. We use a lot of something called penile rehab for patients who are not getting good erections, clearly don't have good morning erections. Vacuum tumescence devices that have been around in various forms for 3 decades are utilized, much like someone who's had a heart attack. After a heart attack and they've been cleared to exercise, they go out to the gym and have cardiac rehab programs where they're, again, using their heart to improve blood flow and get collateralization of vessels to the heart. We're doing the same thing with vacuum tumescence devices. Through negative pressure or suction, there are canisters that can be utilized that are handheld devices that insurance companies pay for that help dilate the vessels, draw blood that's rich in oxygen to those tissues, and help preserve the size and shape that you have. For those patients who have been scarred from either trauma with penile plaque or infections, there's actually some growing evidence, if you will, that vigorous use of vacuum tumescence devices can be employed to break up that plaque, stretch out that tissue, and improve size and shape or change size and shape. There are traction devices that have hit the market recently that are touted to do similar things. So there are things that can be done not only to preserve the tissue, but to improve some of the sequelae or the aftermath of scarring and plaque formation that sometimes occurs.
The Department of Sexual Health is a unique facility dedicated to evaluating and treating both men and women for sexual dysfunction. We are proud to offer such a facility and reach out to our community in an effort to raise awareness about the potential risks that cause sexual dysfunction. We believe that this private issue is becoming more open to discussion with the men and women of today, and we are here to help rekindle relationships as well as teach wellness, healthy lifestyles, and bring back a quality of life we all deserve. At the Department of Sexual Health, we are here for you when you're ready for us.